Well, hello and welcome to Rajat Sabha TV. You're watching India Fights Back with the host Rajat Kain. It's a show which gets you the latest on how India and the world is preparing against COVID-19 pandemic, how they are fighting, how authorities and of course our frontline health workers, the medical staff are working round the clock to fight this pandemic. Well, in this edition of the show, we'll take up a very important issue of COVID's correlation with gastrointestinal system, or to simply say our digestive system, how it can affect the digestive system of a person suffering or that has already recovered from COVID illness. Now, as per one study, 10 to 15% of COVID-19 patients have only gastrointestinal symptoms. It's very important to understand here that so far, we have primarily focused on the preliminary symptoms of respiratory issues or complications like the chest infection, coughing, cold. Now, nausea, vomiting and diarrhea are also the symptoms to look out. It therefore becomes necessary to test those who have gastrointestinal symptoms as well as we test their respiratory system. And the experts have not ruled out the chances of coronavirus infection affecting the pre-existing digestive system situation even further. So how important it becomes to understand a correlation between the COVID and gastro care. To discuss on this very important issue, we're joined with three important panel of guests. Now, Dr. Pramod Garg, he's Professor, Department of Gastro from AIIMS. Dr. Shikha Sharma, a very well-known nutritionist, and Dr. Neeraj Nishchal, he's Associate Professor, Department of Medicine from AIIMS. Well, many thanks for joining us. Let me start with you, Dr. Pramod Garg. You are the expert in terms of gastroenterology. Now, in common parlance, we may say you know everything about the digestive system in this panel. So, the first basic question, how important it is to look for symptoms relating to the digestive system?
Thank you, Rajat. So many patients with coronavirus infection, COVID-19, may have symptoms which are referred to digestive system, and these include abdominal pain, nausea, vomiting, and sometimes diarrhea.
Right.
Now, a patient may have primarily respiratory symptoms, as most patients actually have, but may also have associated digestive symptoms referable to intestine. Very few of them will only present with symptoms related to intestinal tract, for example, abdominal pain and diarrhea.
Right. Well, many thanks, Doctor, for your opening remarks. We'll come back to what further complications can be caused by coronavirus to the pre-existing condition, but that's later. Let me go off to Dr. Neeraj Nishchal here. He's Associate Professor, Department of Medicine from AIIMS. Sir, we would like to understand here the entire mechanism of digestive system and how prone it becomes when we talk of any viral infection. How does even a common viral infection affects our digestive system, sir?
So there are various mechanisms with which this virus, or for that matter, any viral infection can affect GI tract. It could be just by affecting the cells of the GI tract. It could simply affect the immune system of the GI tract, which leads to malabsorption and other aspects. So if we talk about this particular COVID-19 disease and this coronavirus infection, the receptors through which it enters the host cells, again, it's widely distributed, and GI tract is one of that primary site of ACE2 receptors. So the possibility of it affecting these cells directly is there, and of course the permeability aspect is also affected, leading to all the digestive system symptoms which we have talked about, whether it's diarrhea, abdominal bloating, abdominal pain. All these symptoms can be there, and again, the one important aspect which we have to look into such patients is that the drugs which they are taking for the management of COVID, even they can precipitate all these symptoms. So we have to differentiate whether the symptom is because of the disease per se or because of the treatment which we are giving, and that may have treatment implications, basically.
Right. We'll come back to you, Dr. Nischal. Let me go off to Dr. Shikha Sharma. Ma'am, many thanks for joining us in the show. A very basic question I would like to start with. How susceptible are the gut issue when it comes to having a balanced diet, and what exactly would you recommend for such a situation? We're talking of the viral infection in general. We'll ask more specific questions about the COVID later in the show. But first, let's start with the basic, or for that matter, any viral infection and how it affects the gut.
See, fundamentally, any viral infection, and you have rotaviruses and other viruses which also infect the gut. But primarily, when we talk about the gut, there are only three presenting symptoms, which is pain, abdominal cramping, loose motions, diarrhea.
Right.
So these are the presenting symptoms. Now, irrespective of which virus is affecting, there are fundamental intestinal health. The first is hydration. So hydration is very, very important. You have to have your 1 to 2 liters of water. The second thing is improving the microbe of, the gut biome, which is the bacteria, the good bacteria, the unhealthy bacteria. The entire gut biome has to be improved. And that happens with a couple of things. The first thing is turmeric is very good. It is anti-inflammatory. And traditionally in our eating habits, turmeric was used. Second thing is vitamin C. Vitamin C is really essential for building immunity. Even gut has a very huge amount of immune cells. And it actually has a lot of nerve cells and immune cells. So for that, amla is important and it should be taken regularly. Third thing is hygiene. Like in Corona times, it's not good to eat out, which is like chaat, papri, and those kind of things, which in any case we advise, even in other situations, but definitely in these times. Fourth thing is a lot of people have a leaky gut syndrome. Now, what really happens is when over a period of time, you're having foods which have trans fats, like, all the packaged food, the chips, fried food, which is oil, which has artificial oil. Artificial means trans fat oil. Now, this starts acting the gut. So that means you have to have natural oils. The best natural thing which you can have is cold pressed oils, like cold pressed peanut oil, cold pressed sarson oil. But I have also seen that if you eat coconut during this time, because coconut has anti-inflammatory, antifungal, antibacterial properties. So a little bit of is very good for the diet. And instead of having, say, fried snacks or chivra and all, one can slice coconut, dried coconut, and have that along with roasted peanuts, roasted grams during the thing. Of course, if you are having cramps, then you could not have roasted grams and other things. Finally, I would say it's very important to build your gut immunity. You also have to have probiotics. So a lot of probiotics are available, and you can choose whichever.
Right. Ma'am, many thanks for opening remarks. We'll come back to you. Let me go to Dr. Garg here. So it's really important to understand first, like the dietary pattern and explained by Dr. Sharma, that assumes a paramount importance. So do you believe that the affecting of gut can be transmitted by food and water as well? So, I mean, if anybody who is having the least of symptoms of COVID should be very careful about what they're eating and what water they're having. Dr. Garg?
So I think there are two issues here. One is in general, the other is specific to COVID-19.
Yes, absolutely.
In general, of course, the advice for anybody is that to eat healthy food and take safe water. I mean, there's no denying the fact that for any illness for that matter, particularly for preventing any illness. When it comes to specifically to COVID, the question that is asked is, can it be transmitted through food and water?
Yeah.
Now, so far, evidence doesn't really prove that.
Okay.
It hasn't really proven that it can be transmitted or not be transmitted. So I think a prudent advice here would be that be careful about your diet, be careful what you eat and what you drink. It is always best to have your homemade food and water which is safe. It may be boiled, it may not be boiled, which is fine. But I cannot say today that it is transmitted through food and water, so be very, very careful. There's no point scaring the public, saying that it can be transmitted through food.
Right. Before I go off to other panelists, Dr. Garg, let me ask you, in last few months, ever since we have had the phenomenal rise of COVID-19 virus and cases are reported, is there a particular trend you have seen patients with gastrointestinal symptoms, the number of them increasing ever since the COVID has hit all of us?
So I don't think we have had increase in number of patients coming with digestive disorders or increase in patients coming with symptoms related to intestinal tract. Let me give you two aspects of it. One is that a patient who has developed COVID-19 may present with some GI symptoms.
Okay.
And
Okay.
to assure the public at large, I would say that these are minor ailments.
Okay.
We are not really worried about them. So one should be scared if somebody has abdominal pain or diarrhea and has COVID-19 symptoms. The other is that some patients might have an underlying disease related to the digestive system, and then they can get, more complications. So when I talk about a digestive system, we have basically three or four things. One is intestine, the other is liver, and the third is pancreas.
Yeah.
Now, what we have seen is, and we have studied and published also, that patients who have got underlying liver disease are at increased risk of developing complications. And I think that is something to be watch out for.
Okay.
So, for example, someone has known liver disease or someone may not have known liver disease. If we find on testing that the liver enzymes are increased or liver function tests are abnormal, we are a little worried. We have to be more careful. But by and large, we do not advise people to have testing for liver function test when they are at home if they have a mild disease. Similarly, someone who has got an underlying intestinal disease, for example, there is a group of disorders called inflammatory bowel disease or ulcerative colitis, Crohn's disease, which you might have heard about. If someone has such an illness, then this infection can increase the severity of the disease or precipitate an acute attack in them.
Okay. Okay.
Third is
Right.
that we have seen is some of these patients have developed what we call as acute pancreatitis because of the COVID-19 infection. But that's rare. If you talk about numbers, that would be very, very minuscule. Just because we are in tertiary care hospitals, we see all these patients. But by and large, people shouldn't be worried about these.
Well, many thanks, Dr. Garg. Dr. Nishal, I would like to ask a specific question about a study that was conducted by AIIMS, and it was an individual doctor who has conducted the study, and he mentioned that 10 to 15% of COVID-19 patients may present only with the gastrointestinal symptoms and no respiratory symptoms. Now, is it like 10 to 15% happens to be fairly number to be noticed? So, are we seeing some sort of, do we need to take the study into further cognizance and need to understand which all symptoms the COVID-19 is showing off late? Or is it very normal with the virus?
That was part of one of the presentations which we had made as a part of our clinical grand round. And what we have observed that if you take the symptoms and the liver enzyme derangement, which we have seen in our patients, the overall percentage of people having some sort of GI symptom is 15 to 20%. And like Sir clearly mentioned that most of these things are just asymptomatic type of stuff, which will resolve on its own without requiring any significant intervention. So these are just numbers, and that will not translate into overall outcome of the patient. So those 10 to 15% were our observation during the patients which we have managed in our COVID ward. So it has not been published. That let me make it very clear. It's just observation which we had made during our presentation.
Right. Dr. Sharma, now broad basing our discussion. Now, as we have seen in COVID-19 cases, we are studying this virus vis-a-vis the age group of people. If I ask you now, which age group happens to be more susceptible in terms of having hit by the virus, and therefore you would recommend should be very careful about their dietary pattern, especially in these times? Which age group you would like to alarm? I mean, if I may not use the word alarm, but at least you would recommend that they should be careful about what they eat and what they drink.
See, fundamentally, the COVID virus, if you see statistically, it is harder on the senior age group. Now, why senior age group? It has nothing to do with the age. It has more to do with the comorbidities. Like in senior ages, normally people are more likely to have diabetes, more likely to have liver, fatty liver, more likely to have other conditions. But it doesn't mean that if someone is a senior citizen and they are in the pink of health and they are very healthy, they are they are at the same risk. No. the fundamental thing is people who have comorbidities or who have already a compromised immune system in one way or the other. So which means that people see who in families, what is the general structure? The younger men and women, they go out and work, and they might have maybe a slightly better immune system because also they're active, they're moving about. They come back home and they carry some amount of virus. Now, this virus gets transmitted to the senior people at home who may not be having that kind of health. They might be having multiple disorders, blood pressure, diabetes, cholesterol, fatty liver. So this compromise in their immune system predisposes them to having the, getting the COVID infection in a larger way. Now, what I would suggest to eat is, see, fundamentally, like there are few rules of eating for immunity. The first thing is to have, don't have fried food, maida, suji, don't eat packaged food, don't have cold drinks with a lot of sugar, don't have too much of salt and papad, achar and all these things because they all compromise your digestibility, your digestion system. Please eat on time. A lot of people, what they do is that they skip meals and there are large gaps in between and they suddenly feel very hungry and they will have something with sugar. Now, that's not healthy. Your metabolic cycle has a rhythm. Third thing I would say is have foods which are generally considered healthy, like, for example, ginger, turmeric, cinnamon. You can, make a decoction out of it and have it regularly. Turmeric, can be with milk. Similarly, don't, people go to the refrigerator, have cold water. Now, this is going to affect the tonsil area and that's a gateway to infection. The next thing I would make sure that you're having unrefined food, like, for example, ragi, millets, oats, bajra, jowar. So don't have only wheat and rice. Particularly in winter, I suggest please don't have so much of rice and wheat and breads. Instead, have ragi, jowar, bajra, things like that, and have hot porridges. Then I would say that make sure please don't have chips and biscuits. Most people in winters, they feel hungry, they have pakoras, chips, biscuits. Now, this is not really healthy because it also has a lot of trans fats. So don't have. And to build immunity, if you start having vegetable juices like of beetroot, tomato, amla, apple, you can have carrots. So you can put a little bit of mint. So all this together, tulsi. Tulsi is an excellent adaptogen and there's enough research in adaptogen. So just make a vegetable juice in which you're putting all these things and you're putting tulsi and ginger and a pinch of turmeric, and that's a great health booster for you.
Right. Well,
Rajat,
you mentioned about, yes, sir.
No, can I just make a point here?
Okay,
in
sir.
general, when
Shortly,
we
sir.
advise about diet, best is to take something which is natural. The moment we make it unnatural, artificial, it affects your health. And the best example that I often give is that nature made cane sugar for us. It never made refined white sugar for us. Get it?
Right.
So I would say you take whatever is natural, you take it. And we generally advise to take 5 servings of fruits and vegetables. If you take 5 servings of fruits and vegetables, you don't need any artificial vitamin supplements or other things.
Right, sir.
So what Dr. Sharma is saying is very right, that take whatever is natural available and don't go for artificial things.
Yes.
Although, I have one question for Dr. Sharma here. Dr. Sharma, you clearly pointed out that the older population happens to be more susceptible, or for that matter, more vulnerable, as they are suffering with, that some of them perhaps could be having comorbidity issue. Now, if we look at the dietary pattern, don't we see children and youngsters, post-teenagers, they are more experimental with their diet. They'll have brunch, and nowadays, like you have, not nowadays, but yeah, for quite some time, we have this trend of binge eating late in the night. So, is it also something to look for? I'm not saying we should be worried about it, but something to look for, especially concerning that age group, the younger population.
See, fundamentally, so far with reports, it was seen that the children were more resistant to COVID. And of course, since it's a new novel virus and only time will tell that what is the actual thing in future. But yes, children did not have those many episodes compared to the senior people and people with comorbidities. Now with teenagers, they could become carriers, if they don't show symptoms, but they have an infection, they could become carriers because again, it is to do with that normally younger people have a higher immunity compared to people who are having comorbidities. So
Right.
yes, it is very important that they should not become carriers and start infecting the other people in the family, and they have to eat healthy. Besides that, I think a couple of things which I missed out was zinc is very important. Sunshine is very important as a natural source of vitamin D.
Yeah.
Vitamin B12 and all B complexes are very important, during this time. So I think people who may be it's also good to, if you can afford it, do a blood check and see what is the status of everything, whether it's vitamin D, whether it's B12, so that you know whether you need support, whether you need help, and then you can talk to a doctor and they'll give you whatever is required.
Right. Dr. Pramod Garg, in the last reply, you talked about the pre-existing medical condition concerning a gut system, digestive system. Now, in just a juxtapositioning of the question that I asked from Dr. Sharma here, which age group having the pre-existing gastro issue would be most vulnerable or falling towards COVID illness?
So I think it doesn't really depend on the age group. It depends on the severity of the underlying disease. So for example, if you have a 30-year-old or a 40-year-old person who has a serious liver disease, he is as susceptible to develop complications as someone who is 70 years old but has a milder disease.
Right.
So it depends on the underlying severity of the disease. So one of the commonest illnesses that we are seeing in general population is this fatty liver disease. So people are obese. They have what we call as central obesity or a visceral fat, which is increased. And these patients have fatty liver disease. Often they are not aware of their disease. They think it is just, obesity, which is not. So such patients are also at risk of having more inflammation in the liver, and their liver function tests are also deranged. So I think we have to be careful about these patients also. But I also want to say something about the overall severity of the disease. Public is already scared about this coronavirus. They think this is something, if you get it, you are going to go, and only very few will survive. This is not true. More than 80 to 90% of patients have mild disease. They can be managed at home, and Dr. Neeraj Ishal will tell you that a large cohort of patients who have never been admitted, never required hospitalization, they all got better. So I think one of the messages to be given to public very clearly is that it is not a disease which is very severe in most. In fact, on the contrary, it is a mild disease in most patients.
Right. Very thanks, Dr. Garg. Over to you, Dr. Nishchal, as your senior just mentioned that you would throw a better light upon whether everyone who is down with COVID or smitten with the virus requires hospitalization, because this is actually a very, very common myth, I would say, that, oh, you're COVID down, go to hospital. Is it so?
So there are two types of patients which we are encountering. One who have mild symptoms where they just want to get admitted. And there is another spectrum of people who are seriously ill, but they don't want to come to hospital. So these both spectrum are actually problematic for us, because if an asymptomatic patient takes our bed, then we are wasting that bed. And if a sick patient is at home, he will come late in the disease, and that by that time, we won't have much option for him left with us. So what I will say, do not panic regarding this disease, but you will have to be vigilant. So identify the risk factors. So this common misconception that youngsters are safe, it's I will say it's highly wrong concept, I will say, because if you see the youngsters, they have obesity, which sir talked about. The central obesity is one of the risk factor which we have realized is associated with poorer prognosis. If you ask me what is the most important factor which we have seen in our practice during last 8-9 months, then obesity has been the most single important factor which has led to poor outcomes. And this obesity part is also very common in young generation. And that's why I will say young generation should not take this disease lightly. Okay, for old people, say, okay, they have comorbidities. But if you lose a young patient, then that's really, really bad for us and bad for everyone. I'm not saying old people should not be safe. But yes, this younger population who have this risk-taking habit and they feel they are immortal, that should not be the idea. And healthy eating should not only limited to those elderly and those with comorbidities, but it should be with everybody. And everybody has to take natural food, as sir has clearly pointed out. It's the natural food which is going to help you. This immune boosters and what all we talk about, the artificial vitamins we talk about, they are not going to boost your immunity. You have to change your lifestyle. And that's
Right.
important to save yourself from COVID.
One of the scientific terms
sir.
that is being used for fat-induced, increase in severity is lipotoxicity,
Okay.
which is also, being implicated now in COVID infections. So obesity in general, and particularly visceral obesity, the central obesity, is bad. So one has to be very careful, regardless of COVID. I'm saying in general.
Absolutely, absolutely. Well, many thanks for joining us. I'm afraid time is short. We should have discussed it more further, but extremely thankful to three of you, Dr. Garg, Dr. Nishchal, and Dr. Sharma, for joining us and telling all our viewers as to what has to be done and what should be avoided. Remember, this is not just a discussion, it's straight words from our doctors and medical experts, many of them who are at the front line fighting this pandemic. Well, many thanks for watching this edition of the show. But before we leave, a small appeal by RSTV to all our viewers. Keep wearing face mask. Keep washing your hands 20 seconds. That's what the expert says, and maintain physical distance. Remember, these are simple things that can help us in defeating this coronavirus pandemic.